Have you heard of a Hartmann's procedure resulting in a Hartmann's pouch? That's the topic of today's discussion. Hi, I'm the ostomy nurse providing tips, tricks, and evidence-based ostomy information. The medical term for Hartmann's procedure is called a proctosigmoidectomy. This means that it's a type of colectomy in which the last part of the colon, the sigmoid, is removed, often along with part of the rectum. Some part of the rectum may be preserved along with the anal sphincter. The remaining rectum is sewn shut, creating a pouch, the Hartmann's pouch. A Hartmann's procedure requires a diverting ostomy, often a colostomy in the proximal part of the colon, or in some cases, an ileostomy, meaning that the diversion had to occur higher up in the small bowel or ileum. Hartmann's procedures are often performed emergently. The most common indications are complicated diverticulitis and colorectal cancer. Less common indications include bowel obstructions, often due to scarring or adhesion, ischemia, tissue death due to lack of blood flow, irritable bowel disease, trauma, and rectal prolapse. Because large inflammatory processes accompany most of these etiologies, it is often unsafe for the surgeon to attempt to reestablish bowel continuity in the same surgery, meaning they can't remove the problem and sew the tissue together and have you heal as if nothing has happened. So, a diversion is needed, allowing the stool to pass through your stoma and into a pouch instead of through the rest of your diseased or inflamed bowel allows that bowel to rest and recover. Your surgeon will help you determine if your ostomy is temporary or permanent. Factors that influence this decision include your nutritional status, the presence of active disease or infection, how well you recovered from your first surgery, and whether that surgery was performed through an open abdominal incision or laparoscopically. The best healing can't occur while your body is inflamed. Be patient with the process and trust that your surgeon will take down that stoma as soon as is safe. And know that your anal sphincter is there and waiting to do its job when you're reconnected.